The first indication of whether the pelvis is aligned or not is the height of the iliac crest. So you may see that my left hand on her right side, this one here, is higher than the other one, which already indicates to us that her pelvis is misaligned. And the reason for that is this hip bone is asymmetrical. So if it rotates forwards or if it rotates backwards, this ridge, the crest, will effectively go up or go down. And in that process, if it rotates backwards, see the hip joint is not in the centre. It's not in the centre of that circle. So if that rotates backwards that way, it takes the hip joint up with it, which means that when we look, that leg will be shorter than the other leg. So we've got two tests. The first test is to put our hands on top of the iliac crest to see whether they're the same height or not. The second test is when she's lying, will be to test to see whether her leg length is the same or not. So even if you're unsure at this stage, so when you get the client on the couch, test the leg length. Right. The second thing we're going to do is I'm going to test that front and back, and then we're going to look to see whether her SI joints are blocked or not. And I'm going to do that by finding the SIPs, putting my finger underneath, and then asking Sahara to bend forwards slowly. These are joints, so they should be free. So you can imagine if she's standing on her feet, the legs and these bones should stay in the same position, but the sacrum and the whole body should tip forwards or tilt forwards with those in between those bones, if you like. So if those joints are free, these bones should not move. If one of those joints is blocked, it'll take this hip bone up with it. And in doing so, we'll see that move upwards. So what I'm going to do now is find the SIPs. I've now got my thumbs tucked underneath those bony prominences at the back, the SIPs. And I'm going to ask Sahara very slowly with the head first to bend forwards, and we'll see what happens. Okay, you may see, be aware, her right one has gone up. Okay, and stop. And come back down again. You may see that my left thumb stays put, which is an indication that that right SI joint is blocked. If this joint is blocked, which it is, her tipping forward rotates that hip bone with it, so the bony bit moves upwards at the same time. The other way of checking the alignment is to find the CAS. Again, the bony, there. And you can see again the right one is higher. They should be level, the same level. Find the level, first of all, on top of the iliac crest. Is it level or is it different? Go around the back, find the SIPs, lock your thumb underneath it, ask the person to bend forward very slowly, and do your thumbs stay put, which they should do, or does one or the other of them move slowly upwards as she bends or he bends forwards, okay? And then see whether you can find the CS. It's a bit of palpation just so that you know what we're looking for, okay? Lovely.